Hi, I'm Dr. Nikita Vizniak here with the amazing
Richard Lebert.
Richard. Why don't you give us a quick introduction to yourself, and then we're going to talk a little bit about low back pain management strategies today.
Yeah, so I'm a registered massage therapist in Petrolia, Ontario. So that's a really small town, I'd say between Detroit and Toronto, right? Halfway in the middle. What I've done, I've put together a resource for massage therapists. It's online. It's called Evidence-Based Massage Therapy, a guide for clinical practice. And it's open access online, so you can find it online. That's the better way to view it. I will be working on refining that book, and maybe in 2022, might have something new there.
Well, exactly. That's how we came in contact, because you're also a contributor for, I got to grab it too. You're one of the major contributors for this one as well, Principles in Practice, which contains a lot of the same information. But what I like about it is exactly that. With our online content, we can always update and upgrade information, right?
Mm-hmm. Yeah. And I think that's a good segue into what we wanted to talk about in this video is back pain, and always like improving and revising the way we'll approach people that come to us with low back pain.
Yeah, it's huge. It's a huge topic. You know, it's like the number 1 or 2 reason for someone to come and see any healthcare professional is low back pain, depending on your research, who you're reading for that. So what are some of the key identifying factors and strategies that we should be aware of according to your research? Richard, what do you think?
Yeah, so what you'll see is in a lot of papers now, clinical practice guidelines, they are recommending massage therapy, right? So when they're recommending massage therapy, let's maximize our approach, or let's give them the best kind of full treatment we can give them to maximize their potential for recovery. So let's say somebody comes in, providing that assessment, right? Doing a detailed assessment, looking at what may be causing their back pain, and also ruling out red flags, or referring out when there's a potential red flag, giving them a complete treatment, sending them home with self-care, and lots of recommendation for heat or ice, depending on what the patient prefers.
Mm-hmm. And prior to this, we were talking about the importance of assessment, right? We were going to give our top 3 ideas around treatments for low back pain. And I think you can apply most of them actually to any treatment for any region of the body. But the first one, I think, is the patient wants to be listened to. They want to actually be heard and being able to tell their story, right?
Mm-hmm.
Yeah. And what are some other strategies that you like to use?
What I often tell students is assessments isn't one thing you do at the beginning of a treatment. An assessment is talking to them at the beginning, talking to them throughout the treatment, and talking to them at the end to find out like what's going on in their life, what changed, what's been improving, what's stressing them out. When you're treating them on the table, what's sore, what reproduces symptoms? Are they getting a lot of discomfort from laying kind of on their stomach, a big pillow propped up under their stomach? Is that little arch in the back, is that bugging them, or is laying flat? So assessments aren't one thing you do at the beginning. It's done throughout the whole treatment.
Mm-hmm. And I always say in our seminars too, assessment is therapeutic. People don't realize the value of an assessment. It's great for ruling in and ruling out causes of pathology potentially. And anything you can rule out helps decrease the patient's level of anxiety or negative emotion associated with the low back pain.
Yeah. And having that confidence in assessments. So assessments we learn in school, maybe we have 1 or 2 that we're still using, but sometimes we're not confident in our ability to execute certain tests, or we're like, oh, we can never reproduce symptoms. But I think having a starting point of maybe doing a straight leg raise, really working on that, refining it to help rule in, rule out, maybe working on a slump test as well. Then we have stuff like Kemp's test, or we have stuff like Faber, like checking out the hips too. If people have ongoing back pain, you got to rule out something with the hips. So there's lots of different tests with the hips, like figure 4, Faber's, Faders, but always working on those.
Yeah, absolutely. And the key thing there is knowing the value of those tests, like how reliable they are. Hey, I wonder if anybody knows of a resource looking behind me here where we have videos of all these orthopedic tests that you can go ahead and look at, right? But on a more simple level, you can take those tests and turn them into therapy. One thing that I'll commonly do for a straight leg raise test is why don't you turn it right away into a muscle energy technique or a nerve flossing technique or contract, relax, PNF, whatever you want to say. But already you can start to challenge the person into an area where they perceive they have pain and limitation and kind of break through those barriers if you do it in a gentle way where, which is great in all of your writing, you have good communication with your person.
Yeah, I think that's a great point. Flossing, nerve flossing can be a great kind of graded exposure activity for them to perform, especially if they're having the symptoms down the leg. No, you'd want to have training for this because sometimes that can reproduce symptoms, can be a bit uncomfortable. But when people, like, that's a self-management thing. Once people learn that nerve flossing, it can be really, really valuable.
Yeah, absolutely. I've had my own low back pain bouts. I got a couple of YouTube videos up. If you just type in Vizniak low back pain, you can go ahead and see what I went through to get well relatively quickly. And I think one of the best assessments you can do and one of the best treatments you can do is just simple range of motion, challenging the area a little bit in a safe way and gradually exploring the pain barriers that you might have and expanding beyond those.
Yeah, but yeah, it doesn't have to be difficult, right? Think about simple yoga moves that can be modified, right? Like cat camel, child's pose, the yoga book there.
Yoga book, yep.
Like, it does not have to be difficult. I always work with, I work with everybody, right? I work with young athletes, I work with older patients, and you can find ways to modify different yoga poses are so convenient. And that's how they were kind of like designed up, right?
Yeah.
For everybody to help promote health.
Absolutely. I've had patients who have had such significant low back pain that they've had to sleep in a child's pose, just rounded back over like this. But eventually you explore the area, you start finding new range, you give the body time to heal. Because I mean, really, what do? We're supporting the body's natural healing abilities on a cellular level, right?
Yes.
So you're giving them time to get through that. And then they can start to explore. And in the meantime, they haven't locked their body down and not challenged and not moved and maybe got a longer progression of how long it takes for them to heal and potentially even worse outcomes, right?
Yeah. Walking, like, this is my progression as I'm getting older. I'm not in my 30s, right? You told 20-year-old me, walking is going to be this great exercise for back pain, for all these different things. I'm like, what? Why? Right? As I'm getting older, I'm like, walking is very therapeutic. All of it, like the social aspect of it, the kind of walking around in nature, and even just the loosening up you'll do, gardening, all those simple activities, simple exercises are great. But try telling that to a younger version of me, right?
But you're exactly right though. So you've got to meet your patient with low back pain where they are at the time, right? So if they're, if they're more into like they're some kind of bodybuilder or CrossFitter or lifter or something, they're going to want to see more active, aggressive treatments. And maybe we just have to step them back a little bit. Take somebody on the opposite end of the spectrum, and maybe they're a desk-bound worker. They're not moving very much. Maybe they're a little bit overweight. All of that stuff is going on, and we've got to accelerate them up a little bit in the chain, right? Get them moving a little bit more and challenge themselves in fun ways, and that's the key thing. Whatever you give somebody to do, and you hit the nail right on the head right there with the social aspect of what you're doing. It's got to be fun what you get somebody to do, or else they're not going to do it.
Yeah, I would say that will be a big thing from COVID. Is I play recreation. I play softball in a beer league, right? Again, tell a younger me that's going to be good exercise. That's going to be activity. But missing out on 2 years of that and then going back, that's a valuable thing, right? I'm getting out there. I bike when I go. I go out there. I run out to the field. I'm playing with everyone. I stretch at the beginning. I probably don't stretch if I'm not playing.
Yep.
And so you're missing out on 2 years of just that social aspect of exercise. So recreational sports and all that. All of that, like, that's the important part of exercise, is that socialization of it, running groups, walking groups, even doing it on your own. It can be fun, like Peloton stuff, right? Anyways, but I think that's a big thing. It's like, oh, how can we make exercise fun, and hopefully work on ways to make that fun and engaging, because that's what's going to like rewire you to keep doing it.
Yeah, exactly. The positive empowerment of people with low back pain is the key way for you to get them over the hurdle of the fear of movement and future injury. So many patients come in, I'm sure you've experienced this as well. They come in and they're just like, I'm scared to move my back because I'm scared it's going to break or I'm going to hurt it or whatever it is. And they don't want to have a setback. Well, setbacks are going to happen sometimes, but it's more important that you challenge it and work through it than actually cease all movement where you think that just if I keep it stable, things are going to be fine. You really want to explore those ranges with strength, with mobility and flexibility, right?
Yeah. So graded exposure, building up a kind of confidence in your back and your ability to do different things, right?
Yeah.
But that's like, I can talk like any practitioner who has hurt their back, even though we know so much about back pain, you still wake up and you're like, oh my goodness. And it can be so debilitating, and you just kind of got to rev yourself up and say, oh yeah, this is likely going to go away in 6 weeks. And it's going to keep decreasing over the next couple of weeks. I might have flare-ups, but as long as I'm staying active, get a bit of treatment, put some heat to it, it's likely going to keep going down, right?
Yep.
But
that's the natural history of the condition. Absolutely. Yeah.
Yeah. But you can wake up and with all the knowledge we have and still think, oh God, what did I do? Right.
When you can't put your socks on in the morning and you're like, you're trying to think what happened here. Right. But again, you realize the resilience of the body and how we can get better from these things. So, all right. Any final thoughts on low back pain?
No, I got one thing I wanted to add in. There is a great resource, and I forget if it's through all of Canada, or I think it's a health resource. It's called the Core Back Assessment Tool. I don't know if you know about that.
Yeah.
Anyways, CORE, Core Back Assessment Tool. And it is a fantastic resource if people are like, I don't know where to start with certain assessments. I don't know what to rule out. I don't know how to approach people with low back pain. Look up this resource. You'll find it online and print it off. And it's a really good checklist. And there's other resources available with it. But it's a great starting point to kind of build up your confidence treating people with back pain.
All right. Fantastic. Yep. And of course, there's always CE seminars you can take from 101 different practitioners that are going to walk through the same thing, that are going to get you through it. So we offer some as well. But either way, Richard, thank you very much for your time. We've got some great low back pain management strategies that are 100% evidence-based. Flash your book up there again. It's absolutely fantastic. Okay. You can check it out, free source online. He's a contributor for this one as well. So anatomy, assessment, action, massage therapy. Fantastic. And I cannot thank you enough, Richard, for being involved in our projects and for doing what you do for the profession and all the people out there who are suffering from different conditions as well. So especially low back pain.
Thanks for having me.
All right. Good stuff.